All right, good evening, everybody. I'd like to call to order the March 14th meeting of the Community Mental Health Program and Budget. I'd like to start off by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Need a motion for the adoption of the agenda. Motion from Commissioner Birdie, support from Commissioner Doherty. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is hearing of the public. Anybody from the public wishing to speak? 5 minutes. Going once, going twice. All right, we will close the hearing of the public. Next, request to approve. Request to approve the extension of the current Macomb Community Mental Health Specialty Services contracts for an additional 12 months to be effective October 1st, 2018 through September 30th of 2019. Motion from Commissioner Vosberg, support from Commissioner Flynn. Is there anybody that would like to? Commissioner Birdie.
Does this affect the committee that was meeting to discuss rewriting contracts?
The committee concluded its work, and there were no more. There was no reconvening of the meeting. The outcome of that meeting, one, was that the procurement practices that we had in place were satisfactory to the committee and to this board. The contract itself, there were 3 or 4 recommendations that I recall that would be, valuable when we get to the point where we rewrite the contract. One was that instead of having so many attachments, why not just include all that language into the body of the contract itself? Also, there was interest in having more assurances that the residential providers would be responsible for retention of the workforce. And then the other issue was, good question, there was another issue that came up too relative to what we would include in that contract. So the committee is not re-meeting or going to meet again on this. So the answer to your question, no, it doesn't affect that committee. What this is a proposal, as you've read, to bring the contract forward now. And so in October of 2018, instead of rewriting a new contract and putting the effort, I remember the third thing. The third thing was to put more of an emphasis in monitoring the providers to the standards, to the expectations of the contract. And so that's what this proposal is about. Since there's not any significant material, statutory rate changes in the contract, we felt the effort was better put towards contract monitoring and just issue an extension to the providers that will extend the contract for 1 year. If the board approves to go that direction, then what we would do, I believe in July, is bring to you at the conclusion of our committee work, recommendation on who we would like to move forward with for your approval in the way of the contract extension, and who we would let the contract just merely sundown. We would not offer an extension.
Well, I noticed that, so there must be some contracts that you don't intend to extend.
There may be. I don't know off the top of my head, but when the committee reconvenes, the business management has a committee that monitors for quality assurances and claims and a number of performance metrics, at which point in time that committee convenes. They will make a recommendation to myself, which I'll bring to the board, either to approve or no longer continue to contract with a provider. But that committee has not convened yet.
Right. One more question.
Go ahead, Lou.
With the extension, when would the present contracts expire?
With the extension, then the contracts would expire in September 30th, 2019.
Which means that some 109 plus contracts that we presently have would be redone again starting in July, less the ones that you don't intend to renew. Is that basically correct?
No.
But it would probably be July of 19.
Yep. Correct. In July of 19. This year, we would not change any of the material content of the contract, nor the rates, because the rates aren't going to change.
Thank you.
Okay.
Brian?
Why are we asking to do it so early to extend the contract? I mean, it's almost 8 months out before it expires.
If the board doesn't want to proceed in this direction, then I understand that. Then we need to turn around really quickly and put together the contract so we can bring it back to the board in May, a new contract to the board in May. It's going to have the material sameness. So I think it's an exercise that's not going to benefit anybody other than create a lot of work. But if the board does not want to go with the extension of the contract, then we would have to write a new contract for 2 years. We would start that right away, bring it to the board in May, and if the board approves it, then that would give it June, July, August to be able to extend it out to the providers because they have a 90-day review period, return it back to us so we can go on October 1st. So if you say no to this, we have to get back to work. There's that much lead time in your contracting process.
There's a year lead time or 8 months lead time for contracts?
Yeah, typically we start revising the contract in January. So here it is, we're in March, but typically we do in January. How that process goes is the current contract is sent out to all the directors of business. I'm sorry, the business director sends out all the contract to all the current directors. So it sends it to the clinical services director, sends it to recipient rights director, sends it to the finance director, and asks for commentary and opinion. What has changed in the contract that you need, or what new language you need to put in the contract relative to bringing it up to speed for another issuance for 2 more years. It would go to corporation counsel, or it would go to our in-house counsel to look at any legal changes or any information that would need to be changed in the contract. After the directors have had an opportunity to do that, then we rewrite the contract. And at that point in time, it's reviewed again in committee. We send it over to the office of the county executive. County executive reviews it. Corporation counsel reviews it at the executive's office, sends it back to us with a blessing on it. And we also lately have been seeking outside counsel from Plunkett Cooney, because there's a portion of that contract that's related to the My Health Link demonstration. It's highly technical, related to the Medicaid, Medicare requirements for My Health Link, and we get the best resource out of Plunkett Cooney to be able to make sure that the language is correct. So the answer, yes, it takes about 5 months to get to you.
Well, my question is, if this is what they're recommending doing, so why don't they recommend this in July, when it's closer to the expiration of the contract?
Supposedly, hypothetically, in July, you say no. Then that means we have to rewrite the contract. And we should have been rewriting the contract back in January.
Well, this is all far out because a lot of things could change in this time period. They could change.
Yep.
They could hurt us too.
Well, you can always do an amendment to a contract. I mean, the packet simply says is that there's no gain to rewrite the contract. There's nothing, the material and content that's changing in the contract.
Well, I mean, I'm questioning the fact that the time lapse. 8 months early is a long time to sign a contract that's 8 months away from expiring. Where we're saying right now that we don't want to change anything. They don't want to change anything either. But there's an 8 month There's an 8 month period in there that things could change. So why not present this? Like you said, well, you have to go back in negotiation and everything else. But 8 months is a long time.
It takes 5 months to prepare the contract, and it takes 3 months to offer it up to, like someone like Henry Ford Hospital. They're just not going to sign it. They're going to send it to their corporation counsel. They're going to send it to their legal folks. So part of our standard business practices are, by history, for as long as I can recall, takes about 5 months to prepare the contract, to be able to get it on the agenda for the board, to be approved by the board, to be issued to the provider network, and to get it executed. So it takes that long.
I just don't remember voting on a contract 8 months out prior to expiring.
You typically vote on it in May.
Okay, thank you.
And if you don't want to go this direction, then my staff got a whole lot of work to do in the next 60 days to bring you the contract in May.
Any other questions? Comments? All right, seeing none, we have a motion and support to move to full board. All in favor signify by saying aye. Aye. All opposed?
Polls.
Brian. All right, that motion passes. Next is a request to approve the appointment of Miss Laura Cutting to the Citizens Advisory Council. Take a motion to approve. Motion from Commissioner Brown, support from Commissioner Bush. Is Ms. Cutting here? No? All right. All in favor signify. Sorry, go ahead. Any questions or comments? Yeah, I see ya. Linda.
I'm the liaison to the CAC, and I just have to say that John and Lori Valueway have done an incredible job of recruiting new blood to the committee, and they have a really hardworking, smart representative group now, and Laura is a great addition to that. She, for a long time, they've been reporting when NAMI meetings are, but people would say, well, why don't we have a representative from NAMI? And she's very involved with NAMI. I think she's coming to the full board. She has a Wednesday commitment, so she couldn't come tonight, but she's trying to make it the next time. But this is a great recommendation, and I highly support it.
Thank you, Linda. Any other comments, questions? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? All right, motion passes. Next is a request to approve the commercial lease amendment for the UBHC. Take a motion to approve. Motion from Commissioner Brown, I'm sorry.
Support.
Support from Commissioner Flynn. Anybody want to speak to this?
I think it's good.
Let them go first, Lou. Thank you, guys.
Better? Okay. What you have before you is a lease amendment for the UBHC building. In the lease amendment, there are two items that are going to be changed, and that is the total usable square footage of the building. It is currently listed as lease as 25,396. It would be amended to state 19,910. Also, the lease would be amended for a reduction in total cost of $512K. Those two changes came about when this building went to sale. It's still not sold, but it's in the process of being sold. In that sale process, a survey was conducted, and it was discovered that there was a miscalculation on the total usable square footage. They brought it to our attention, the current landlord brought it to our attention and wanted to quickly correct it. We worked with him over the last couple of weeks to, again, change the total square footage, but also to reduce the total cost. So again, that 512 is a direct correlation to the reduction of total square footage.
Thank you. We have Commissioner Doherty and then Commissioner Birdie.
Thank you, Mr. Chair. Through the chair, so what we're basically doing, I'm just trying to understand what I'm seeing in front of me here. So because we had essentially had too much square footage in the math for our rent, what they're doing is they're taking all of the overcharged back rent and they're reincorporating it into a new rate?
Correct.
Because, yeah, I'm confused by the charts that are in the documentation, and that, it looked like our rates, first they went up a little bit and then they steeply went down, but now it appears that we're just leveling off to a higher rate, which was confusing to me.
The total differential over the cost of the 5-year lease is $512,000. That's what the overall difference in the square footage is.
Okay.
After reviewing our lease and legal reviewing our lease, we determined that getting out of the lease or trying to restructure the lease in a different way, it was not going to be that easy. So we applied all of that money. We went after every single penny that we felt we were wronged in being misled on the square footage, and we've applied it to the lease moving forward.
So you're telling me that really net everything is going to be zero.
That's correct.
But I understand the $500,000 is over the course of the 5-year lease. How, and I could do the math, but I haven't done the math. How much of that is done already? Like, how much have we,
Sure,
is
so I
it
can
200,000 that we paid too much already, or what is that?
So in the last year and 6 months, because this would begin in April next month, we would overexpended by 100 and, forgive me, I believe it's 156, something like that. We will recover in the next 7 months everything that would have been overexpended, and then save moving forward the additional months. So there's 41 months left in this lease out of a 60-month lease.
Okay, so here's my only problem is, time value of money, right? Did we account for that in any way? I mean, we've overpaid them $100,000, and then now they get how many months to pay it back to us? Like,
There was also this variable that when we went into this lease, we had $500,000 worth of build-out done to this building. And that was incorporated or rolled into the first 3 years of this lease. That was the way that we could finance, if you all recall, that lease was placed in front of you. That's how we financed that project. So they're also losing out on that money that they put up front for that build-out as well.
well, I would venture to guess they built the time value of money for that into our rent, right? I mean, maybe there was a $500,000 build-out expense, but, maybe it was really $450,000. Yeah, I mean, business people do that, right? They do time value of money expense.
We did think of that. We are putting our absolute best leg forward in this, in that we're taking advantage of it in the sale of this building at this time. The timing has worked out well for us to take advantage of recouping all of that money. We did take that value of interest into consideration in this negotiation. Tracy fought really hard to get back every bit of that. The offer was much lower, and for us to sort of backtrack on it would have went to legal, the sale would fall apart, and we would have to deal with this for a long time to come.
Yeah, just to reiterate what TJ is suggesting is we really are bringing before you the best that we were able to accomplish. The original offer was $250,000 less from this. And although we can appreciate the fact that there is some interest lost there, because of the timing of all this, we have a great opportunity to quickly fix it and have instant savings beginning next month.
I would also add this, because I know that the UBHC has been in a bit of a negative light lately. It's not just the UBHC that we house there. We have another almost 100 employees that are housed there as well. So if for some reason this building were to close, we would be struggling to try to find someplace to put 150 employees as well. So we took all of that into consideration in this negotiation.
And why would the building close? You said it was being sold. If they can't sell it, they still have to honor the
That's correct, but we
lease.
could choose to vacate based on the lease in being incorrect, being sold a bill of goods that wasn't incorrect at the start, which would have, we think, turned into sort of a legal wrangling.
True. Okay, thank you. That's all the questions I have.
Commissioner Birdie?
Well, like Susan, I was also confused with your charts. My first reaction was that we were paying some $25 or $26 a square foot on 25,000 square feet. And the reality is that there was only 19. And they found that out because the new buyer obviously did an evaluation on the square footage because he was buying on a square footage situation. So that identified the fact that we had overpaid for a year and a half, $25 or $26 on 6,000 square feet. So the first thing I looked for was a credit for the amount of money that we had expended for a year and a half, and I don't find it. Now, I hear you saying that this credit is going to come forward months ahead of scale. But when I look at your substitute paragraph in the contract, it's still 2626 and 2689 a square foot. So the square footage hasn't changed. So tell me again how we get credit when the square footage for 19,000 is the same for when it was for 25,000, and the substitute paragraph is still the same amount of money. Now you're telling me that downstream some years it's going to appear, and I'm going to say, show me the credit, because I do not see it, and this substitute is going to evolve in a new contract. So my concern is, your documentation frankly confuses me, when, if we agree to this, this contract is going to come out on this basis, and until the second year, or the third year almost, it doesn't get reduced in the amount of a credit being forthcoming. Now, TJ, when you speak to the build-out that the builder did to accommodate our needs, he did that to accommodate the fact that we were going to sign a 5-year lease with him, and we were going to pick up that accommodation in square footage increased costs through, say, the third year of the contract. And in the third year of the contract, it now goes down to $16, and I don't see the credit that ought to be pronounced on the basis of overpaying $26 for 6,000 square feet that didn't exist. So you're going to have to help me with that, or I'm going to vote no. It's that simple to me. This is not a clear contract adjustment as far as I'm concerned, because it doesn't provide the credit in the front that should be there. And if you fold in the explanation that we're picking up the build-out costs, that still exists, what does that really have to do with the credit? Because that isn't going to change under this contract. We're still going to pick up those build-out costs. So that's my position, and like Susan said, I think your documentation is confusing, because I think if a third party picks it up, they're going to wonder where is the credit, because the credit isn't forthcoming.
Sure, and I'm happy to explain. It is a very confusing process. If you look at the lease amendment summary, it has 2 charts on it. So the lease amendment summary, the page that would have occurred prior to the actual lease.
Well, that's what I was referring to. If you heard me say that it goes
Lou, she's
$15 in that 4th year.
Lou, she's asking you to look at it, and she's going to explain it to you. Let her explain it to you. Go ahead.
It is confusing, so I guess I wanted to start and make sure we understand where do you even get to the 500K, and then to your point, where are we seeing it at? So if you take that first chart there, this is the whole lease, remembering that we are in month 40 of a 60-month lease. We've already paid out money, but in order to ensure that we get every penny back, we took that first column in year 1, it says price per square foot. In the lease amendment, or in the lease currently, we were paying $20.60 times 25,376 square feet. In the new lease amendment in the chart, all the square footage prices are being multiplied by 19,910. So again, to get to the $500,000 variance, it's going to be $20.60 times 25,376, which annualizes to the 4th column over, which is in the current, I'm sorry, the 3rd column over, which is in the current lease of $522,000 annually for the first 12 months. When you then look at the lease, the reason why it still lists $522,000 is because we've already paid that out. We haven't, it's been paid to this landlord because the first year and a half through March has already been paid. And
that was my point.
Mm-hmm.
We've already paid it, and we overpaid it in that sum of money.
Correct.
By 6,000 square feet
Correct.
The landlord owes us a credit.
Correct. And now, if I can finish explaining it, will all make sense after that. So imagine if you're looking at the lease amendment and it says months 1 through 12. Again, we've already paid out the $522K. Months 13 through 18, $267,000. We've already paid out. There is a recovery if you're looking at the lease amendment summary of what we need to recover per year. But again, we're not backtracking in time. We're moving forward to recover the full amount. So then if you look at months 19 through 24, if you multiply $16 a square foot times 19,910, it's going to give you these dollar amounts. And if you just look at that one time frame, instead of us costing the original lease of, in year 3, $45,000 a month, we are paying $26,000 a month. So when you add up this math, the whole lease as a whole, starting in month 41 through month 60, has a net gain of $512,000, and that does include the recovery of the money that we have already paid out.
But you just said that we paid the 43 and the 44, but that was based on the fact of 25,000 square feet. So when we're now paying 26, that's now based, as you said, on 19,000 square feet. So where is the credit on the overpayment of 43 and 44 of 6,000 square feet every single time?
I don't want to try to oversimplify it, Lou, but if I may.
Try it.
The overall 5-year lease, we would have been wronged $512,000 in the overall lease. We recognize that within the past month, and we're going to recoup that $512,000 moving forward. So it is a credit to what we've already paid. Does that, if that makes sense? That's an oversimplification.
Well, here, let me oversimplify it back. The 500,000 that you refer to would have been an overpayment of 500,000 if we paid 3 more years in the lease. But that doesn't exist, TJ, because the error was found in the 2nd year. So you're saying the 500,000 overpayment doesn't exist. The overpayment is 2/5 of that less than the 500,000. So you can't keep referring to a lease that would have been 500,000 over,
Lou,
when in fact that never
Commissioner
occurred.
Birdie, was there a point of order over there?
Just a point of information, Lou, if you look at that chart, which isn't right in front of me right now, if you look at that chart, if we would have paid, I think what TJ is trying to say, if we would have paid that full lease the way it was originally written, it would have totaled, what was it, 512. No.
Well, the
No,
total
it would
lease
have,
is $2,003,000.
it would have,
We would have overpaid.
right here, it would have $2.3 million. I got it now, thanks. But instead, they've amended it after a 5-year period. We're going to be paying $1.8 million, thereby recognizing our $500,000 reduction.
That I understand. But what I don't see in this amendment that's provided is a credit for the 6,000 square feet that didn't exist, that we actually paid for a year and a half.
But that's the new factor going forward. The 19th, there's recognition of, doesn't really matter how we get it. We need $500,000 coming back to us. And I see, when I look at this, I see we're getting we're going to be paying $500,000 less at the end of the contract.
We would have paid it would have been $500,000 less if the error was not discovered.
Correct.
But the error has been discovered. and it discovered after we overpaid 6,000 square feet for a year and a half. So keep telling me about saving 500,000 doesn't exist.
Okay, if we could get a clarification, but this $500,000 variance, is that in that? As I understand that is like recalculating the new square footage over the whole 5 years.
Correct. And Mr. Birdie, if I may, I don't know if this will help, but in year one, to your point, we overpaid by 112K, which is in that chart. So if we just looked at the first 12 months, they in theory owe us 112. So to recover that in the first 7 months of this amendment, we will well exceed the savings of 112 that we would have already overpaid. So if you just stopped the lease at that moment, within 7 months, you would recover what you overpaid. Does that make
Okay.
sense at all?
We have other speakers, Lou. Commissioner Bush.
Mine was about you. When you're done with the money, I need to talk about the program.
No, go ahead.
Thanks. I'll just give them a break on money for a minute then. When I saw it was UBHC, it occurred to me that the programming has been changed and reduced and what they do there. So I was glad to hear you've housed other employees there and you get that cost savings. There is still a concern to me about last year's budget and the underfunding, the use of, first of all, the use of general fund money and the fact that we were in the red at the end of the year. So I would like a report, maybe at the next meeting or next program on budget, where we are with that general fund. The Citizens Advisory Council is very concerned that general fund money is being kind of, they use the term wasted at UBHC, so.
You all set?
Yes, thanks.
Okay. Just checking. Anybody?
Go
ahead, TJ.
Sorry, Phil. And that's why I threw that caveat out there. This is not just the UBHC. This is a building that we house other programs in as well. I wanted to make sure that everybody kept that in mind. Yeah, yeah.
Call the question.
Commissioner Vosberg, did you have something, or was that from earlier? Okay, we have a call to question. So the motion, we have a call to question. So we have a motion and support. All in favor of approving the commercial lease amendment for the UBHC signify by saying aye. Aye. All opposed?
By the way, when somebody calls the question, don't you take a vote on calling the question, Mr. Chairman?
Yes. Sorry, Lou. All right.
I would say that would be the correct procedure.
Okay, Commissioner Birdie.
Record me as a no. Okay. Let me know when I can ask my last question, because I think it's very relevant. Now?
Nope. All right, we're moving on. Thank you both. Next up is a receive and file non-liability of CMHSPs for PIHP's risk under MDHHS master contract. I'll take a motion and support for the receive and file. Motion from Commissioner Vosberg.
Support.
Support from Commissioner Flynn. John, did you want to speak?
Yeah,
to that?
just quickly, even though it says it's an attorney-client privilege document, it's been circulated to about 900 people on the Michigan Association of, or CMHA, Community Mental Health Association of Michigan. It was really a request, as you know, and some of the PIHPs are having difficulty with their financial obligation in their internal services fund, and the request for the opinion was whether or not the Community Mental Health Services Program, it's not germane to Macomb County or the standalone PIHPs, but it is germane to a PIHP that has multiple Community Mental Health Services program. So the ask does the Community Mental Health, or do the Community Mental Health Services programs also bear the risk for assuring the preservation of an ISF to be shared with the PIHP? This opinion pretty much says they do not. I know there's another opinion out there that quite is contrary to this. I put it on the agenda. for the board's awareness, I think the most important piece of the document to be really had is on page 19, really page 2 of the opinion, that really speaks to a reaffirmation that the PHPs need to carry internal services fund. So it really doesn't talk about risk mitigation as much as it talks about what we've all known and understand the importance of an internal services fund for our risk. And so beyond that, I don't think it has much value to Macomb County PHP.
Does anybody have any questions or comments for John about this? All right, seeing none, we have a motion and support. All in favor of receiving and filing signify by saying aye. Aye. All opposed? All right, received and filed. Next is a receive and file the executive brief financial report of February 28th, 2018. I'll take a motion and support to receive and file. Motion from Commissioner Bush and support from Commissioner Schmidt. Go ahead, John.
This is the typical and usual fashion in which we present our executive brief. Cynthia Mack, the CFO, is going to present it as she has in the same format as previous. And as a reminder, and she'll remind you as well too, this executive brief is exactly how we closed out of our contract last September 30th, 2017. And we don't know that, how we closed out, until February 28th. So really you're looking at figures, how we closed out last year and how we're actually starting October 1st for 2018. Go ahead, Cynthia.
Great, thank you. As John mentioned, this is the information that represents where we ended for fiscal year 16-17, ending 9/30. We submitted this on our financial status report, otherwise known as our FSR, which we did receive and sent all of that information to the state timely on February 28th. This is the usual format that you've been seeing, and what I'll do is go through the Medicaid, then I'll go through the Healthy Michigan, we'll look at it combined, and then I'll move to general fund. So I ask if I'll go through the report first, and then I'll take questions at the end. The first slide that you should see, you'll have both Medicaid and Healthy Michigan. If I start out looking at the column starting with fiscal year 16-17 actuals, you'll see for Medicaid, we started the year with a $15 million balance in our ISF. Our revenues for CMH alone came in at $145 million. We combine that with our revenue for our substance abuse department at roughly $3.3 million for a total combined revenue for Medicaid of $148.5 million. Our CMH only expenses came in at $161.2 million, combined with our substance abuse expenses of $3.2 for a total of $164.5 million. That resulted in a deficit of 15.9, telling us that basically we overspent our Medicaid by roughly $16 million for fiscal year 16-17. We were able and decided to redirect some of our Healthy Michigan funds to help cover this deficit by redirecting $5.2 million of our Healthy Michigan funds. That reduced our deficit to $10.7 million. When we take that deficit and deduct that from our beginning ISF balance of $15 million, that leaves us with an ending balance for our Medicaid ISF of $4.3 million. Then I itemized the $5 million grant that we received from the state that is to be used to solely fund the Medicaid ISF. So with that, in addition to the 4.3, our ending Medicaid ISF is 9.3 million. Moving into our projections for this year, right now, if I can just point out, that is solely a projection. The only thing that is updated in that column is our beginning ISF balance, updating that to the 9.3. Our revenue figure, if I can comment, at our next update to this report, after our next report, is due to the state, we'll have updated figures. It will include actuals on our revenue received for the first quarter, as well as updates to our expenses as well. What I'd also like to point out is for the $146.5 million that right there is listed, I do expect that we'll see some changes. Most likely that we'll see a decrease in that based on the information that we're receiving on the rates with primarily the DAB to TANF and HMP movement that we've all been discussing for the last few months. So walking through the numbers for 17-18, starting with the 9.3 opening ISF balance, again, using the revenue that we right now have just projected at 146.5, carrying over our substance abuse revenue expected at 2.8, we're expecting our revenue to be at roughly $149.4 million. On the expense side, the numbers that are listed there are off of our budget that was already approved last year with the county. So again, once we have updated figures, not only with our budget that we'll be doing in the next few months, at the next report, we'll also have updates as far as the updated expenses that we've seen for the first quarter of the year. Using what we have right now budgeted, our total expenses, however, are projected at $146.6 million, leaving us with a surplus of $2.7 million. Again, going off the same rationale with a redirect from Healthy Michigan, we were moving over $1.9 million, leaving us with an ISF of 4.7, or adding to our ISF of 4.7 million. Taking that addition to the opening ISF of 9.3, we would be looking at a closing ISF 17-18, that would be September of 2018, at 14 million. Likewise, on the Healthy Michigan side, for 16-17, we opened up with an ISF balance of roughly $338,000. We did have a carry forward that we started the year of $7.8 million. Our revenue for CMH only came in at $10.8 million, substance abuse $6.7 million, for a total revenue 16-17 Healthy Michigan of $25.4. Our CMH expenses came in at $13.1 million, substance abuse $6.1, for a total of $19.3, leaving us with a Healthy Michigan surplus of $6.1 million. As I referenced, the redirect on the Medicaid side, we took that as a deduction here, lowering and reducing our surplus down to $913,000. We take that and added that to the beginning ISF balance for an ending ISF balance of $1.2 million. Moving that over to 17-18, opening up with the $1.2 million, we no longer have that Healthy Michigan carry forward, so we're solely relying on our Healthy Michigan revenue, again, based on what we have had from the last report of $12.7 million. Again, we'll have updated figures at the next quarterly report. Our substance abuse revenue, $6.7 million, for a total of $19.5. Going off of our budgeted expenses for Healthy Michigan, 10.6 for CMH, 6.7 substance abuse, a total of 17.3, resulting in a surplus of 2.1 million. Again, we have to move the redirect over that we took to Medicaid, reducing that surplus, bringing that down to a $213,000 surplus. We add that to the ISF opening balance, resulting in a 1.4 ISF for Healthy Michigan, pretty consistent with where we ended this year. On the slide for the combined, because when we do report this on our FSR, we do have the ability to combine and report that likewise. For the 16-17 beginning ISF combined balance, Medicaid Healthy Michigan, we opened 16-17 with a 15.4 ISF. We included the carry forward. We have the revenue from both CMH and substance abuse for a total revenue of $174 million. Our CMH and substance abuse expenses combined $183.8 million for a total deficit of $9.7 million combined between Medicaid and Healthy Michigan. Our redirects netted out to a $37.5 thousand deficit decrease, resulting in a 9.7, again, almost 9.8 deficit to be deducted from our opening ISF balance. That resulted in a 5.6 ISF combined. However, again, adding in the $5 million grant from the state, bringing it to a 10.6 combined ISF as of 9/30/17. Starting again 17-18, carrying that $10.6 million ISF, looking at our revenue totaling $168 million, looking at our budgeted expenses right now at $164 million, resulting in a surplus of 4.9. Taking that surplus, adding that to our ISF opening balance, we would be looking at roughly a 15.5 ending ISF. Moving over to the general fund slide. For 16-17, we started with a carry forward, $379.8 thousand. Our GF allocation was 8.4, so our total general fund revenue for 16-17 closed at $8.8 million. However, our expenses for 16-17 closed out general fund at $9.5 million, resulting in a deficit of $630,000 in deficit. We're not allowed to show that as a deficit on our reporting, so in order to do that, we need to cover that with our local funds and then show that netted out to be zero. Moving into 16-17, therefore, we have no carry forward of general funds, and we did get notice of our GF allocation would be roughly $727,000 less than what we received last year. So our general allocation that we're looking for is $8.1 million. If we stay on track with the expenses as we had budgeted as of last year, our expenses would be $7.7 million, giving us a slight surplus of $419,000. And again, as far as that GF allocation, if I can just bring note, I believe there was some documentation that was shared by John as far as that was a GF redistribution and heavily hit to Macomb, Oakland, and Wayne.
Thank you. My iPad's going a little haywire, so if anybody has questions, please raise your hand. We'll go Commissioner Bush and then Commissioner Vosberg.
The $700,000 you said was a redirect out of from Lansing, out of the 3 counties?
It was called a redistribution.
Do you know the rationale? Just because we have it and they took it?
There's Macomb, Oakland, and Wayne County were affected again this year on general fund redistribution. And it's the same premise as the Medicaid redistribution. They believe we have more Medicaid or more general fund dollars than we actually need. And so, you know, we're losing, I won't say who's losing what, but we're losing $725,000, and our neighbors to the west and south are losing a whole lot more than that.
Then I have another question. And you might not be able to explain it to me in this setting, so let me ask it, and if we need to talk later. But back to the Medicaid fiscal year 16-17, the deficit of $10 million, how did we eat that? Where is it? Because that's the 15 million minus the 5 million is the 10 million, but I don't see where we made up that 10 million anywhere else in that line.
If I'm understanding your question correctly, the 10 million deficit, obviously we overspent our Medicaid dollars by 16 million in total. However, we did a redirect of Healthy Michigan funds, and then we had the $5 million grant to basically make up that $10 million deficit.
Right, but I thought that $5 million grant was added to the $4 million to give us the $9 million for next year, not to fix the deficit.
I'm not sure if we're actually going to understand on the same page here. If I can go back to the deficit, well, and start from there.
Yes, the
The 15 million, if we
yes.
go there.
Okay.
The 15 million was the roughly 16 million in
Right.
overspending. So our revenue that we received came in under what our expenses were, resulting in that $16 million deficit. When we took that $16 million and we applied the Healthy Michigan redirect, it brought it down to a $10 million deficit.
Right.
So when we take that $10 million and we take that away from our opening ISF balance of 15, because we have to take the deficit, we reduce that from our ISF, it results in that 4.3.
Oh, so we did have a balance last year, and so the 10 million comes off that balance. Okay.
We started from the opening balance of that ISF.
Okay, thanks.
Does that help?
Yep, you
Okay.
did it. Good work.
Commissioner Vosberg?
Thank you, Mr. Chair. On that same page, then showing Medicaid on the left side, Healthy Michigan on the right. I think this is more a question for John, but if Healthy Michigan goes away, does this just get erased, or do we have some kind of makeup that we might have to do? And
Well-
I'm asking that in the light of if the funding for Healthy Michigan doesn't change, it may, in fact,
At this point in time, I think Healthy Michigan, the program itself is going to be preserved for 18. I do understand that it may or may not be available in 2019. But at this point in time, there's new enrollees who can enroll into Healthy Michigan plan. Whether the legislature extends Healthy Michigan in 2019, I don't know that. But I mean, we don't know that. Nobody knows that at this point in time. But that's been discussed. At that point in time, all of this Healthy Michigan, at some place there will be a cost settlement on what our expenses are and what our revenues are, and then the Healthy Michigan line will be gone. And so you'll be solely dependent on your Medicaid dollars.
right. So we just wouldn't service people. Well, they wouldn't have any insurance to pay for any services is what would happen. All right. Then on the third page of the general fund, could you explain again in the, I'm in the wrong page here. The fiscal year 16-17 column, you'd mentioned there was a deficit of 630,000, which we can't show a deficit. So what did you say about?
We draw that from our local funding.
That's
So we
the
have
local.
an unrestricted balance,
Okay.
and so we draw from that to cover that deficit.
Okay. And that local funding, that's the, what is it, 4 million or whatever that we get from the Board of Commissioners General Fund. I mean, in that,
Correct.
in
I
that, the
don't
county
have the
budget.
exact figure, but yes, you're correct.
Okay. All right. Thank you. Thank you, Mr. Chair.
Any other questions or comments? John?
I just want to embellish this a little bit further. You know, we talk a lot about leases, and that gets 45 minutes worth of attention. That's good stuff. Let's not walk lightly on what you're looking at here. You know, last year we were $25 million upside down at this time when we were going to expend all of our $15 million in ISF, plus we were going to be indebted to the department to the tune of $10 million. Okay, that didn't happen. You know, we were able to correct a good portion of that, and so we actually ended up overspending $16 million. So there was some correction to be had there. The precariousness of this report is related to, one, we have the $5 million that we were so aggressive in getting through the legislature. That's in there as a placeholder. Again, the $5.6 million, that's, you know, when you look at the combined report, that $5.6 million is HMP, Healthy Michigan Plan dollars. So in actuality, we really don't have any ISF on the Medicaid side, only the $5 million grant and then the HMP, which you cannot use to cover your debt. We've talked about that. So when you look at projection 2017-18, we should have 12.6 million in ISF, and we have 10.6, so we're $2 million shy. So this board needs to understand, for the last 8 or 10 years, we've been fully funded at this point in time. Moving into the fiscal year, this is the first year we're not fully funded. It's strictly, it's $2 million short. That being said, our projection is, which I think is favorable. I know last year our projection was to be $25 million upside down, as I indicated. This year our projection that we're really going to have a $5 million savings. So if that rings true, then we've done our work. Okay. The concern is it's strictly a projection right now. We don't know absolute what our revenues are going to be, nor do we know absolute what our expenses are going to be. So that's why there continues to be a need for due diligence to attend to revenues, make sure everybody has Medicaid, everybody's all hands on deck to make sure Medicaid enrollments are up, to be able to provide services to people who are Medicaid enrolled, those who have a Medicaid benefit, nothing more than medical necessity, nothing less than medical necessity. It's always good to hear that again. And if we can hold true on this, then we actually are in a favorable position at the end of the year. But there's a lot of assumptions that are built into this, so there's no time to take your eyes off of the financial challenge and the opportunity ahead of us. And I'll say that with that, you have some correspondence today that you're going to read later on tonight. I'm not going to defend any of the correspondence because I've read it as well too. And this is about money. We've all understand the challenges that we have here, whether it's the board, administration, the provider, the consumers, and most importantly, the consumers. This is about money. And when you take $40 or $45 million off the table, which we've done, there's a significant effect to everybody and a ripple effect that we don't even understand in some instances as well too. But we've taken in essence about $45 million off the table. So when you start looking at some of the concern of the provider network relative to their request for collaboration of services and those types of things, much of the underpinning is what they really need is more money, and I think they should have more money. We don't have that more money. And when you talk about the general fund, the more pressing issues that are facing us right now are related to the general fund. We were $600,000 overspent on the general fund, and that's why we're not purchasing someone's spend down. It's hard to grasp, but historically, if someone didn't meet their spend down, we paid for it out of general fund. We don't have the general fund dollars to pay their spend down, and what is being delivered in the way of services here in Macomb County is no different than any other county in the country. When a consumer meets their spend down, then they have Medicaid. Until they meet their spend down, it's their obligation to cough up their own monies based on ability to pay to meet their spend down. And then at that point in time, Medicaid it takes effect. So I just want everybody to it doesn't hurt for me to repeat it. And I, appreciate you putting up with me as I do repeat it, because I think it really needs to resonate with us that taking that that much money off the table hurts everybody.
Any other questions or comments? Commissioner Bush?
To what John just said, looking at the 2018, 18-19, and saying that we need to have 12.6 and showing that we have 9.3, but we're asking for 7.5. So that 9.3 is just that money that's a placeholder, 5 million of it. We still really need the 7.5. This doesn't show that we need 7.5. So I think that's confusing to people who might see it outside of getting this explanation. And then could you, and it won't restore any services, it's ISF. So your point, I applaud you pounding every chance you get that we're really 40-some million short, not just that ISF money. But could you give a report on what you know about the 7.5 request, where it is, what you've heard, what's What's,
We can do it now, or I can do it as another agenda item.
Okay,
I'd prefer
okay,
to close this
yes.
out. Yeah, thanks.
Thanks.
Any other questions or comments? All right, seeing none, we have a motion and support to receive and file. All in favor signify by saying aye. Aye. All opposed? All right, received and filed. Next up is a resolution. We have none. And then other possible agenda items. Any other commissioners? Go ahead, Commissioner Birdie.
Those commissioners who participate in the state executive board meeting, you need to adjust your calendar.
Could you put your mic on?
Put your mic on.
Would you put your mic on, please?
I'm sorry. Those commissioners who handle the state executive board meeting, you need to adjust your calendar. The executive board meeting scheduled for April 13th, which is a Friday, has been canceled. The reason is that it's proximate to the executive board meeting that will be held at the spring conference, and any items will be carried forward to that executive board meeting. So adjust your calendars to cancel April 13th.
Thank you, Lou. Commissioner Bush?
And the spring conference dates have changed, and all I got was April 30th. Is that correct? They've been moved forward? Okay, thanks.
Would you say that? I have that at home, but I didn't bring it with me.
Thanks.
Do we need Mr.
You said April 30th to
Yeah.
May 3rd,
Right.
just in case anybody missed it.
Yeah, I think it's April 30th, maybe May 2nd, not May 3rd.
Okay.
And it's going to be in November.
Do we need a motion to attend the conference, or is it too soon?
We could probably do that at the next.
At full
We
board?
could do that at full board, yep.
I also, through the chair, would like to mention about the PAC. So if you haven't turned in your money, quite a few have turned in their money. You can give it to me or Barbara. We have to have it in by May, and it's good to have everything before.
Thank you. Any other commissioners with any other agenda items? John, do you have anything to add?
Yeah, two different topics. One informational, and the other one is discussion. One is the direct care wage pass-through. There's some discussion relative to that. Want the board to know that the PIHP, our PIHP, delivered that direct care wage pass-through at the same time the other PIHPs did. Most of them occurred on or around January 1st. They were retroactive back to October 1, and we had to report out to the department by February 1st. So I'm pleased to tell you that 96% of our direct care workers have received the 50-cent direct care wage pass-through. So 4,700 in excess of 4,700 staff, direct care workers, now have that 50-cent direct care wage pass-through. I'm sorry, about 4,500. We missed it by about 180 staff. Okay, I don't mean to be confusing. So there's about 180 direct care workers out there that still don't have those dollars. And some of the providers are holding that up. And my initiative and effort is either they pass that out readily by March 15th, or I want it returned. And I want the dollars returned to this board, and I'll send it back to the department with explanation. What is happening is the providers are holding some of the direct care workers as captive, and it's not acceptable. It's deplorable, and I want the monies returned if those dollars aren't issued by tomorrow, March 13th or March 15th. And then the other item that we should talk about here is we've been meeting with the lobbyist, with Gary Owen, and with Marilyn Lane, now with the Office of the County Exec, and the strategy on the $7.5 million. So I think I did convey to you and provided you with an update, if I'm not mistaken, on my meeting with the House and with the House Legislature. I forget the date. I think it was on March 7th. I did have a meeting with them. They were well attentive and pretty aggressive in the way of the fact that they want to pursue the entire $7.5 million, no concessions related to that. The discussion ensued between a couple of the House members that it would be better positioned for Macomb CMH if the county proper also coughed up a little bit of money to indicate that there's local initiative to support the state initiative, the general fund dollars. So in my email to you earlier, I suggested that the Board of Commissioners and the county executive offer up $750,000, and then 10% of that would be $7.5 million. So I'll leave it to the discussion of the board here what you believe would be a fair ask, knowing that last year when the lobbyists asked the county executive, they said zero. They weren't offering up any dollars at all. So I'll leave it up to this board for discussion. Two things. One, what should be the ask of the county executive, if anything, as far as matching dollars towards the $7.5 million as good faith effort? And then two, how do we do that?
Commissioner Vosberg.
Thank you, Mr. Chair. I would, if we could get 10% above and beyond the 7.5 million, I think that would be great. So instead of being a matching, they would match 10% on every dollar from the state. I would not want to see the state giving 90% and the county giving 10%. But for the county to say we're willing to give some more, I think that sounds fair now that I'm not a county commissioner anymore. I have to vote on that.
That means it comes on me, right? Any other comments about this? Commissioner Birdie and then Commissioner DeGovan.
I just find it interesting and slightly humorous that the state cuts us $40 million, and you're talking about putting up 10% to get 7.5 back. Doesn't that strike anybody in this room as ridiculous? Or just me? The state cuts us $40 million, and let's put up $750,000 to get 7.5, which we wouldn't need if the state hadn't cut us $40 million. And by the way, the budget that was balanced has been done on the back of consumer services, and not one single comment was made about how that balance occurred. I'm frankly very disappointed. Done on the back of reduced services to consumers. That's how it happened, where our position is improved over last year, and not a single comment. So,
Commissioner DeGovan.
It is amazing. They took $40 million from us, and we're asking the county executor to put in 10% to pay to good faith, to give to the state to say we need the money back, when it's only a third of what they took from us, when their state's sitting on a $900 million rainy day fund. I don't know where the rainy day is going to come when I'm hearing they're trying to build it up to $1 million. I mean, and it's hitting our consumers. I all honestly think if we're going to put in 10%, if you're going to ask the county commission to put in 10%, the county executive put in 10%, we ought to go for $30 million and tell them to give us back the money so we can reinstate the services that have been cut. The rainy day fund out there sitting on $1 billion is like telling us we don't need our ISFO to run this department. It's the same premise. So that rainy day fund, we should explain, if you're going to play these games like that, bring it down to zero. Put it back to where it's supposed to go. I don't think it's a good idea to have the county executor pay that 10%, or the Macomb County commissioners. I think we should go after the money where it was taken from, and that was from the state, and get it back from the state.
Am I on the list?
Mr. Chair, I got the light up.
Oh, you got to raise your hand, wave at me. Commissioner Flynn and Commissioner Vosberg.
The county exec said no one time, and you'll probably say no again. Now, do the commissioners have the money that they can help us? I have to agree. I don't truly agree a lot of times with Brian and Lou, but I think we should go for the whole thing. I mean, from the state, from trying to get it back from the state. I don't think we're going to get any help from anybody, not unless we have a millage passed.
Thank you, Commissioner. John and then Commissioner Vosberg.
Thanks for letting me to jump in here. The strategy is, you know, the Department of Health and Human Services is not going to give you the money back. I shouldn't say names, but the Department of Health and Human Services is not going to give you the money back. We've made the administration aware of that. You know, last year I spoke, and Kathy and a few others were there. We spoke with Nick Lyon and Chris Priest, who was the Medicaid director. They understood at that point in time our $12.5 million was reasonable, just a matter of how to do it. You know, last week I spoke with John Walsh, the state budget director, and he understands the situation, and he was going to go back and speak with Nick Lyon as well too. So right now the focus is on the $12.5 million. But none of those folks are going to give you that money back. You all know politics and how it works in the budget. The only way you're going to get the money back, as I understand it, according to the strategic idea of the lobbyist, is you get enough of the House members in Macomb. You only need 5 or 6 House members in Macomb to say, no, we're not passing the budget without our $7.5 million in there. And if they stick together, along with a few no votes on the west side of the state, the budget won't fly. Your challenge is going to be is how are we going to make it important enough, every one of us, you and me and all of us, how are we going to make it important enough to us that our legislature goes to battle to that extent for 7.5, let alone 40? You know, you've got the answer to that. That is the way to get to it. You have to, you know, be able to tell your legislator, don't approve the budget without 7.5 million, and if you want to say don't approve the budget without 40 million, that's all on them. You know?
Commissioner Vosberg and Commissioner Doherty.
Thank you, Mr. Chair. I wanted to address the issue of getting back the money from getting all 40 back, or how we deal with the state legislature now. It's two different. We're not talking about the same thing, because the legislature appropriated all the money, the same amount of money. It's the department that redistributed. So the legislators are frustrated because they appropriated the full amount of money. They didn't control. They gave the control to the department. The department chose to redistribute. And so right now their fight is with. They have to work with their fellow legislators. And so one of the things that they find helpful is if they can say, but there is it's not just us wanting this money, there's local support. Whether the Board of Commissioners and the executive decide to do that or not, that's up to them. But I think they asked us to ask, so I think we should ask. That's what I wanted to just say about that part. And yes, we did lose a whole bunch of money, but it wasn't because our legislators voted to send it somewhere else. It was the department's decision to do that. Did I state that correctly? Thank you. Thank you, Mr. Chair.
Commissioner Doherty, then Commissioner Bush.
Thank you, Mr. Chair. Thank you, Commissioner Vosberg, for clarifying that, because I listened to the numbers, and I know the 40 million, and I know the rebasing and all that other stuff. You're right, though. It never connected the dots that the legislature did appropriate the same amount of money. So it's not like they took a cut and we're asking them to restore a cut. It's the department's actions that have done that. And I agree that we can ask the executive's office or the Board of Commissioners or both to, put up this good faith money. But quite frankly, when I was a commissioner, I would have said no to that. I supported, increasing the tax rate at the time, and I supported expenditures that others might have disagreed with. So it's not even like I'm afraid to spend the money. It's just that I think it sets a very dangerous precedent and we've seen this time and time again, where state makes a cut, whether it's a departmental cut or a budget cut or whatever it is, but a cut comes through, and then the locals have to pick up the slack. I mean, that is very dangerous. And the same, I'm an advocate for a millage, but I'm almost afraid to, I'll do it because I believe in the cause, but I feel like if we were miraculously able to get an initiative on the ballot and then we were miraculously able to get it passed, and I'm hopeful, I still have hope that those things might happen. I feel like if we found this pot of gold at the end of the rainbow that our residents give us, right, if they voted for it, the state would just say, well, you got all kinds of money, then you don't need ours. And they would cut our appropriation even more. And it's like, I feel like you can't win for losing. So I'm not quite sure what the answer is. I have mixed feelings about asking for the money, but if you think it'll get us the $7.5 million, great. But I think if this county's putting up money, we need to not only ask for the $7.5 million, but I think we need to ask for something from the department to give us back at least some of the 40 that we lost, so we can restore some of the services that have been lost, right? I mean, the $7.5 million, I keep stressing, the $7.5 million does not restore not one bit of service. And to me, I know that we got to plug the hole first and then restore the service, but I'm really having a hard time with the fact that we are battling to restore, to get this hole plugged, when where my heart tells me is I got to restore the services. It's really hard to take the first step when I know I got to take the 10-mile journey, right? So, I don't know. I'm frustrated. Thank you.
Commissioner Bush?
I agree with what Kathy said. We never ask for the $40 million back. That's a conversation we've just been having the last couple of months when John put it in black and white. We asked them for we asked them to help us have an ISF, and it came down to they gave us $5 million, and now we're asking another 7.5. So we've never asked for the 40. So to hold up the negotiations for the 7.5 because you're asking, well, address rebasing, that hasn't even. There are people talking about that. The legislators are talking about that because they finally get it, how we've been harmed by rebasing. But that's not what's on the table now. And I just want to say that I thought Marilyn Lane's response to John was kind of interesting. If you're just going to say zero, you don't ask how much do you want. And that was her question. What are you asking for? So let's all hold a good thought on it at least.
Commissioner Nagovin.
You're absolutely correct. The legislator approves the money to go to it, and the department didn't do it. But the legislator put that department together, and they can take that department apart if they see that they're not doing what they're requested to do. So the pressure we put onto them is to get that department taken apart and put back to where it's supposed to work for the community. Secondly, they promised us this. The legislator promised us the last time around to give us the $5 million, to give us the $7.5 million this year to fix the budget, which has not gone through, and that's what we've been arguing for, to what they've already committed to do verbally to give to us. It's not, we've been fighting for it, we were promised to get it. Thirdly, you do it like it says you put it in millage, they're exactly going to turn around and say, you got the money, the residents are paying for it, you no longer need state money for it, and they're just going to put it back somewhere else. At one point, the more pressure you put on the legislator, no matter what side they are, and show that the department they put together is not doing their job they're supposed to be doing, they need to take them out of office and put somebody in there that's going to do the job. And I think, if I'm not mistaken, I know that the county executive already said no the last time we asked, but I believe there was a half a year ago that the county commissioner said they will not fund nothing for any shortfall at all to the mental health board. So if that's already in there, they're just going to go back and say, we already told you no. So that's not, we need to put the pressure where it needs to go. That is on the department. It's on Lionhead, and I forget the other one because I'm upset right this minute, but that's where it needs to be done. Thank you.
Commissioner Vosberg.
I don't mean to complicate this, but last time I knew the department was an executive department, so we have to also go after the governor as well. So I mean, it's not.
He's leaving next time.
Okay, but the point is, the legislature appropriates the money, but how it gets spent is up to the executive branch. So you got to factor that in as well. But it never hurts to, if you don't ask for anything, you're going to get nothing. So we got to ask everywhere we can. Thank you.
I guess it's my turn to chime in since I'm in the middle of everything. Board of Commissioners, you are right. Last year it was decided that because we were in such a deficit that the Board of Commissioners was not going to put forth any money towards the fixing the deficit or helping with the deficit. That was decided. I would say we ask again. That was last year. This is this year. Like Commissioner Vosberg said, it doesn't hurt to ask. And as for the state, it was like pulling teeth to get that $5 million. It's going to be even harder to get that $7.5 million. And if you're shooting for the stars for $30 million or $40 million, I think that's going to be an extreme challenge. And even though the 7.5 was promised, that if it wasn't in writing and it's not given to you yet, anything can happen. After working up there for a year, anything can happen. I'm hopeful that we get the 7.5. And I really hope we get that 7.5 to help us because we need it. I'm just not sure if it's going to happen or not. That's just a personal feeling. But like I said, I hope we do. And I think that's all I have from my perspective. Go ahead, Commissioner.
Mr. Chair, since you brought it up that you think that there's money in the county, I got no problem going to ask for it now. I just was going by what they already said. They wasn't going to get it. But since there's no front money, I have no trouble going to ask them.
I just said you can ask. It doesn't hurt to ask.
I'm going to go with your wisdom, brother.
John, go ahead.
I guess, so the point where we're at now then is, I hear what everybody said. Before the Board of Commissioners, and I don't know what the actual verbiage was not going to support us on a bailout. We don't need a bailout. All they're asking for them is that, you throw in $750,000 and we'll draw down another, $7.5 million. That's the ask. Do you want to throw in an ante and draw down $7.5 million? And so if that's what this board wants to vote and do, how do we want to do it? You want to write a letter? You want me to write a letter to co-signed by the board chair? How do you want to do it? And it should go to the county exec, obviously.
I think John makes a great point. This money would be a good faith amount of money to say, hey, if you put this forward, we're working with the state to put forth X amount of dollars. Before it was that, it was, the board is just going to give money to CMH to help with the deficit, but this has something attached to it, and I think that's a little more strong, a little more powerful than what was talked about last year. Commissioner Vosberg?
I'm thinking a resolution from this board to the full board, to the Board of Commissioners, because then it has even more signatures on it, and they appointed us to this board. So I think if they know their appointees are asking for this, I think that would help.
That's a great point. So time is of the essence, and we could put together a resolution, and then if we could have it prepared, let's say the 13th, have it prepared and get it, endorsed, signed by everybody on the board here as an action of the Program and Budget Committee, and then, get it to the Board of Commissioners as quickly as possible. I think every day you waste is a day lost. So I think we could do that without bringing it back to the full board, under the authority of the Program and Budget Committee, put together a resolution, get everybody's signature on it. We'll get it around to everybody, if that's the way you want to go.
I just suggested that if it does get approved by the county commissioners, the same letter should be put together with our names and the county commissioner's name and give it to the county executor to ask for the support of it too.
So we have, go ahead, Commissioner Vosberg.
I make a motion that we send a resolution to the Board of Commissioners requesting $750,000 toward, however it needs to be worded, but that we send a resolution requesting that.
Support.
All right, we have a motion and support.
When will this be
This would be sent, we would probably all sign it at the next program and budget committee meeting, correct? Or would it be, or could we do full board? I prefer full board, but
I think we need to be conscientious of the budget cycle, because once this, from my vantage point, once this clears House and Senate appropriations and is in budget committee or in conference committee, you know, which is going to happen real quickly, I think that once it comes out of conference committee, your opportunity is lost. I think you need to be able to preempt what the House and Senate appropriation committees are both going to do before it goes to conference committee. I don't know the timeline for that. You probably could help out on that. But that's my vantage point. So whatever due diligence needs to occur here, and whenever the Board of Commissioners needs to, I don't think you have time to get this into April. I think it's too late. You have to do it as fast as you can in March, and maybe it's too late in March.
Commissioner Birdie?
Do you want the timeline?
Yes, Commissioner, go ahead.
The State Association predicts that the House and Senate will take their spring Easter vacation, and when they return, they will handle the budget. So that is the state timeline in that fashion. But
And just so everyone's aware, the spring Easter break is the last week of March and the first week of April. So they will reconvene that second week. Commissioner Voss?
first item on the agenda upon return will be the budget.
Thank you, Lou. Commissioner Vosberg?
So I would recommend that this committee send out the resolution. We can always bring it to full board for receive and file after it's been submitted.
All right, we have a motion and support on the floor for a resolution to the Board of Commissioners for 10% of the $7.5 million, so $750,000. All in favor signify by saying aye. Aye. All opposed?
I'm opposed.
Commissioner Birdie?
It sends a very poor message. Very poor message.
All right. Motion passes. Any other agenda items? John, did you have anything else?
No.
All right. Seeing none, hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Anybody from the public? All right. Seeing none, we'll close the hearing of the public. And with that, I'll take a motion to adjourn. Motion from Commissioner Vosberg, support from Commissioner Doherty. All in favor signify by saying aye. Aye. All opposed? We are adjourned. Thank you, everybody.